Welcome back. In this PowerPoint presentation, we're going to talk about intellectual disabilities. So, what are intellectual disabilities? There's a couple categories or rules that have to be met to state someone has an intellectual disability. Characterized by limitations in intellectual functioning and adaptive behavior, you need both to qualify. This is true in the Education Code, in the IDEA 2004, and the DSM criteria. Sometimes you have one or the other, but that person would not have an intellectual disability. It must be diagnosed before age 18, yes, but typically that's due to a trauma. So the most common is TBI. So they have a head injury that's pretty severe, and then their adaptive functioning and their intellectual functioning sort of suffers due to the head trauma. I had one child who had just turned 18, so he was an adult, and he did meet all the qualifications, but he didn't have any head trauma. But there's a lot of evidence that he was performing at an average or above average level prior to an incident, and the incident was drug use. So we eventually, once we got down to, and there wasn't great medical records, he probably had drug-induced psychosis, which is something that can happen with some of the heavier drugs out there. It was a sad story because his intellectual and adaptive functioning were, severely limited after this experience with drugs. So the DSM diagnostic criteria is, you have the deficits in intellectual functioning, and so intelligence, average intelligence is 100. We figure this out by these really broad scale tests where it takes a couple hours to do, and there's lots of problem solving, a lot of different subtests. Most people fall within one standard deviation of 100. So what that is 85 to 115. So most of the population falls there. And then a smaller piece of the population fall outside those numbers on either side, lower and higher. And so essentially to say that somebody has an intellectual disability, they have to score 70 or lower, which is 2 standard deviations from 115 and 15. Some use kind of a looser, maybe like a 75 is okay, but really it should be 70, and really it should be on multiple measures. You shouldn't just use one measure to do this. You should give them more than one intellectual battery. Then we also need deficits in adaptive functioning, so challenges with like practical skills, conceptual skills, such as like dressing themselves, taking care of themselves, brushing teeth, cleaning the house, community skills like navigating the community, going to the store, buying things, going to restaurants and buying stuff. That falls within adaptive skills. I will go over adaptive skills later on, not how to assess them, just what they are. And then it must have an onset during a developmental period. Not that it does happen as an adult, but when that happens, it's those things I talked about, like TBI, traumatic brain injury. I'm trying to work on giving you the full name, not just the letters. It's hard. We have lots of letters in this field. Severity levels. So we typically will give an individual severity level. So mild, we're in that 70 range usually. They have a lot of practical skills. They usually verbally communicate well, or at least in a way that most people can understand. Moderate is usually dropping below 65, in the 60s. They have some self-care skills and some communication skills, but they're going to require support most of their life, their whole life. We have severe is below moderate, very limited speech, and will always need assistance. You most likely can't leave that person alone. They're always going to need help caretaking themselves. And then profound needs constant support. Typically, there's a physical disability with this, and a lot of times there's a lot of limited mobility. Individuals who were completely bedbound, they physically couldn't go beyond, a 6-month range. So they were physically had the same capacity as like a 6-month-old. They can't walk. It's hard to sit up, things like that. And so there's usually a lot of medical conditions, not just intellectual disabilities. So what causes this? There's a lot of things that can cause it. One is genetic conditions. That's probably a fairly common one. Down syndrome, Fragile X causes it. There's a long, long list of genetic conditions that can cause intellectual disabilities. There's prenatal factors. So what that means is when the baby's within utero, so inside the mom, things can happen and it causes an intellectual disability. So that's not outside. Perinatal factors would be once the baby's born. So genetic happens, it's going to happen no matter what. It's within our genetic code, so there's no way to kind of stop it. Prenatal, there was a way to stop it. It would have whatever happened would have been stopped during the pregnancy. But the most common one is fetal alcohol syndrome, or with fetal drug syndrome, just the same, but not alcohol caused. That does cause intellectual disabilities, but infections can cause that during pregnancy, some illnesses during pregnancy. It could have been prevented. That's not against the moms, especially with infections. There's really nothing anyone can do, just meaning that had that not occurred, then this baby would look a lot different. Prenatal factors that happen within the first few hours of life, birth complications, and then oxygen deprivation is probably the number one. There are a lot of things that happen during the birthing process which can deprive baby of oxygen. There's some other stuff that can also happen during the birthing process. And then environmental factors, especially within the first few years of a child's life. Things like lead poisoning or malnutrition can cause intellectual disabilities. Common characteristics are delays in developmental milestones. So they typically, things like walking, self-care are going to be more difficult and come later. They have difficulty understanding and following directions. So there's always some verbal communication struggles, even with, the mild subcategory, there's still verbal communication difficulties. And then there's challenges with problem solving and abstract thinking, the social skills deficits, forming relationships, and dependency on structure. Those are the common ones. Once you meet one person with intellectual disabilities, the next person could look completely different. I've seen people who are bedbound with no language, and I've seen people functioning in a gen ed classroom with supports. It's all over the place. It's a very wide range. So things that we use to help them is there's a lot of educational strategies out there. They will have their own IEP, and typically a modified curriculum is needed. So the difference between accommodations and modifications are accommodations is something like extra time or some extra materials, but they're not doing anything different than their gen ed peers, their typical peers. They do the exact same work with accommodations. Modification means I'm going to actually change the curriculum so that they can complete it and be successful. So, their peers are working on division, maybe they're going to work on addition, simple addition. So that would be a modification. Behavioral supports, social skills training has all been shown to be really effective. Assisted tech, so communication devices, visual schedules, adaptive tools have been shown really effective. And then kind of the number one thing they need is community support, vocational training, supported employment life skills program. A lot of that is to keep them safe in the community so they can live a full life, but need support to stay safe and make the right decisions. Co-occurring disabilities. Okay, this is a little more complicated. Number one, autism with intellectual disabilities. Okay, so I would like you to start thinking about intellectual disabilities as more of a symptom of other things rather than its own disability category. Autistic individuals could have intellectual disabilities, could have this, think of it as a symptom, or they could not have it. Both occur. I think a lot of people tie them together and think everyone who's autistic has an intellectual disability. That's just not true. So sometimes they do and sometimes they don't. It's the same with traumatic brain injury. Sometimes they have their cognition is so low that they would meet that criteria, and sometimes they won't. And if they get a TBI when they're younger, they can still actually meet the diagnostic criteria for this. But if they get it when they're older, they wouldn't, but they could have similar intellectual functioning. A lot of those chromosomal genetic issues, kids have that genetic condition. We can test for it in their blood, but they may or may not have an intellectual disability with that. You always want to think about it that way and not just go automatically when you see some label, go, oh, they have an intellectual disability too. It just doesn't always occur that way. So when you have intellectual, when your cognitive functioning is lower, a lot of other things are lower too, including your emotional regulation and impulsivity. They often meet the criteria for ADHD. Okay. And again, it's sort of the same thing. Like some will have that, some will not have it. A lot of times there's some health issues as well. And epilepsy is one of the larger ones, and other neurological conditions might be associated as well. And then they're really high risk for mental health challenges. It's similar to the reason autistic individuals are. This world is hard for someone with intellectual disabilities. It's not really very accommodating in a lot of settings. And, when you're not accommodated for and things are difficult in settings that it's so easy for other people, you might get anxiety and depression. People with ID can't learn. It's not true. Not even the most profound, there's ways to develop skills. ID always means a person cannot live independently. Nope. There's lots of people with intellectual disabilities who do live independently. It really depends on how severe the intellectual disabilities are and what kind of supports they got. If they get zero support, no, very few can. But with the right support, training, teaching, a lot of times they are able to. They're all the same. It varies a lot. Key takeaways are it's characterized by limitations in intellectual functioning and adaptive behavior. It impacts reasoning, learning, and everyday life skills. Okay, thank you. I'll see you next video.